In 2007, Men's Health magazine ranked Oklahoma City the second fattest city in the nation. That prompted Mayor Mick Cornett to declare his city was going on a diet. The goal was for residents to shed 1 million pounds. They did. Now Oklahoma City is on the magazine's list of fittest cities. To keep that momentum going, a new wellness center is going up in an area where people need help leading a healthy life.
Many neighborhoods in northeast Oklahoma City and county struggle with poverty and poor health.
Income is always a reflection of health status, and there's certainly areas of low income. It also has some drug problems out there, some meth labs and things of that nature.
The neighborhoods also reflect some broader health issues facing all corners of Oklahoma, according to Dr. Stephen Cagle. He's chairman of the board for the Oklahoma City County Health Department.
We find ourselves in Oklahoma in the bottom of every category almost. Diabetes, heart disease, cancer, infant mortality, obesity, teen pregnancy, you name it. We have started moving in a more positive direction. Just a couple of years ago, we sank to 49 out of 50 states. We're moving up, we're to 43rd. And we have a long way to go, and we are certainly going to work on improving that.
Cagle says for northeast Oklahoma City and county, improvement will come thanks to this new 54-acre wellness center. Its campus is a collaboration between the City County Health Department and private enterprise.
We have 15 wonderful partners, ranging from the YMCA, Regional Food Bank, Sisters in Motion, the Oklahoma Securities Employment Organization.
Other partners include Blue Cross Blue Shield of Oklahoma, Integris Health Systems, and the OU Physicians Community Health Clinic. Its on-site clinic offers basic health care for those with and without insurance. The cost of services are set on a sliding scale according to a person's ability to pay.
We are trying to prevent disease, but when people have disease, we are glad for great people like OU Medicine to treat them.
Initial construction and operating costs are expected to run about $16 million. Some funding will come from local, state, and federal dollars. The rest from the private sector.
We would hope as much as a third or a half the money will be coming from the outside when it's all said and done.
The center is part of a 5-year strategy aimed at expanding health improvement outcomes already seen in other parts of Oklahoma City. The first stage of the center's construction includes a 37,000 square foot building to house a variety of services, including a large demonstration kitchen where people can learn to cook and eat healthy foods, an auditorium with a seating capacity of up to 400 people for lectures and seminars, as well as some smaller meeting rooms. There's an exercise studio which will include free weights and soon cardio equipment. But people won't even have to go inside to work up a healthy sweat. Behind the main building, there are 2 types of walking trails. The one under construction closest to the facility is designed to be accessible for people with mobility issues. A second trail will meander up and down the hill to provide a more challenging hiking experience. Perhaps the best part, both offer exceptional views that stretch all the way to downtown Oklahoma City. Additional outdoor amenities will include a community garden where groups and individuals can learn to grow vegetables and ornamental plants. There will be baseball diamonds and soccer fields, and an amphitheater capable of seating several hundred. Future expansion calls for putting in a farmer's market to make fresh foods and especially vegetables more accessible, and a senior center.
The Senior Wellness Center is a little different issue, and as you know, that's funded by the MAPS project.
Dr. Cagle gave Cassandra Bennett a tour of the facility. She grew up and lives in the area. Her health issues began while recovering from a car accident.
My blood pressure was up, my weight was up, I was almost borderline diabetic, my cholesterol, HDL, I don't know, all those, the LDL stuff in your body, it was all out of whack. And I just didn't know what to do about it.
To get things back under control, she enrolled in the Oklahoma City County Health Department's My Heart classes.
You got support, and encouragement. And you saw other people who were really trying to get themselves together. And so when I went back to the doctor to get my good cholesterol checked, I was like, oh, it's getting better. It's getting better. And then my blood pressure had lowered.
This is a key program, particularly launched for this area, some of the high-risk areas near here, to improve people's lives through control of high blood pressure and their heart conditions. Just by recognizing they have a problem, controlling blood pressure, diet, exercise, it can have an amazing amount of return on longevity.
To date, I've lost 21 pounds.
When these walking trails are open in a couple of weeks, Bennett plans to use them to lose even more weight. Dr. Cagle hopes the facility and its programs do more than just help improve the health of people like Bennett living in northwest Oklahoma City and county. He sees it as a model for how communities across the state can develop public-private partnerships to shed millions more pounds, while at the same time shedding unhealthy habits.